Welcome to Skin of Color Savvy, the art and science of treating patients of color, the official podcast of the Skin of Color Society, produced by HCP Live and hosted by SOX leaders. Skin of Color Savvy delves into the latest research, clinical insights, and culturally intelligent and responsive care practices in dermatology with leaders and experts. I am Dr. Tiffany Mayo, and it is my pleasure to be joined by Dr. Steven Daveluy and Jasmine Ivanna Espy. I'll give them a chance to introduce themselves, but before that, I want to introduce today's topic, which is hidradenitis suppurativa in patients of diverse skin types. Dr. Daveluy, Jasmine, please introduce yourselves.
Thanks so much for having us. I'm Steve Daveluy. I am the program director and a professor at Wayne State University. I do general dermatology, medical dermatology, and I've been involved with HS for a while now, and I'm on the board of the HS Foundation, trying to do great things and help out everybody who's affected by HS.
Well, thanks. We are so happy and lucky to have you, Jasmine.
Hi, everyone. My name is Jasmine Ivanna Espy, and I am an HS patient, but I also am the founder and CEO of a nonprofit called ACID, the Association of Hidradenitis Suppurativa and Inflammatory Diseases. And we work with the hidradenitis suppurativa community and associated comorbidities to help them to reclaim their lives and get connected to resources.
Well, we are so lucky to have both of you because you offer such excellent perspectives, both from the physician perspective and from the patient perspective and advocate perspective. Actually, we're all advocates here, but Jasmine, I know that's especially a lot of the work that you do. So let's dive in. I want to first talk about understanding HS in skin of color. So I'll start with Dr. Daveluy. What are some diagnostic challenges or differences in how HS may present in skin of color?
There's a few things we know from clinic and some things that we know from the literature. So most people are probably familiar with the fact that, unfortunately, most patients with HS face a delay of between 7 to 10 years on average of the disease starting and the symptoms showing up and getting their diagnosis. And a lot of time in that time span, they aren't seeing a dermatologist yet. They're seeing their primary care or urgent care or emergency room. Well, the literature shows us that that delay is even longer for patients with skin of color. And we don't fully understand. That's one of the disparities. And there's a few disparities that we don't understand with HS yet. We do know that the inflammation in HS tends to really be focused around the hair follicles in the beginning. And there are differences with different skin types and hair, but that definitely doesn't make up all the differences we see in the disparities for HS. Like I said, we see a longer delay to diagnosis. We often see the literature showing us that patients with skin of color have more severe disease at the time of diagnosis, which probably relates more to access to care and not being able to access dermatologists who can make the diagnosis until the disease has progressed. And then there's also the aspect that we see with a lot of our skin conditions that things can look differently based on skin tone. So it can be harder to appreciate erythema and redness, and it might look more violaceous. And there might be more hyperpigmentation associated with HS too that could throw someone off, especially if they're not familiar with diagnosing disease in different skin tones. They might not recognize it as easily. Luckily, HS isn't too hard of a diagnosis to make if you just know that it exists. And that's one of our big problems is so many providers out there just haven't heard of HS before, so it's not even on their radar.
Yeah, I think, those are some really key things that, we see in our patients who come in a lot. They, talk about delays, talk about misdiagnoses, and sometimes it's related to pigment or difficulty like picking up pigment. But if we kind of lean into those like diagnostic clues, then it doesn't matter, the skin tone. I will ask though, are there differences that pigment or are there differences in scarring that may affect our treatment for patients with skin of color?
Definitely. And I think one of the most obvious examples of that is laser hair removal. So we utilize laser hair removal, especially in earlier HS or kind of mid-stage HS before there's too much tunneling and scarring. The laser can work really well to get rid of the hairs. And the efficacy of different lasers varies based on the skin tone. Since the target chromophore is the melanin in the hairs, but you don't want it to get absorbed by the melanin in the skin. So we know for darker skin types, the ND-YAG laser can offer an effective option that won't cause as much dyspigmentation, hopefully. And then for lighter skin types, maybe the alexandrite would be a better choice. I do always tell dermatologists, I say, if you have a laser, feel free to utilize it. Even if it's not the perfect match, it's still going to be effective for most patients. And if you have that discussion about the risk of the discoloration, a lot of times patients with HS will sort of laugh in your face and point at their armpit or their groin and say, do you see what the HS is doing to me? I don't care if I have a little bit of discoloration from the laser, as long as it gets rid of the pain and these recurrent unpredictable flare-ups. So I always tell people, don't let that be a barrier. And even in the studies of the alexandrite laser, they had patients with skin of color that it worked for. And same thing for the ND-YAG, it worked across different skin tones. But if you have both and you have those options, it is nice to select that based on the patient's skin type.
Are you recommending or using typically the laser hair removal settings? I know there are some manuscripts that actually offer recommendations for settings for HS. So what are you typically doing?
Yes, I usually use, they're pretty much the same ones that the manufacturer recommends, which are sort of based on skin type or Fitzpatrick skin type. And then you sort of increase the fluence each treatment. So it's just like doing regular laser hair removal. And a lot of those publications, if you kind of look at the manufacturer recommendations, they were lining up with them anyway. So I always tell people that makes it a little easier. You're not really doing different settings. You just do the exact same laser hair removal treatment, and then you double pulse the active lesions. And honestly, we've never done it without double pulsing the active lesion in the study. So I don't know if we really need to do that, but it's worked. So that's what we do.
Yeah. I think, a lot of people are hesitant to treat patients with laser, and we have lasers in many of our clinical practices. And so understanding there's not something different that you have to know about, treating these areas, but using those typical settings that you use can be really helpful.
Exactly.
Thank you. Well, I want to switch gears a little bit to Jasmine because I want to ask about the patient journey. So, Jasmine, can you tell us a little bit about your journey to diagnosis and some of the challenges that you faced?
Yes, thank you so much. So I was diagnosed when I was in ninth grade, but I developed HS when I was 13, so around sixth grade. And around that time, I had healthcare. So I had access to a healthcare professional who could see me and look at my symptoms, but I was bounced around to so many different people, and I was told everything from I had a rare blood disorder and I was going to die to having MRSA. So I was on this roller coaster of a ride before I got diagnosed, really trying to understand what was happening to my body, and I couldn't wrap my head around it. I had at that time always been chronically ill, so there was always something going on, but HS was different because it affected my skin and it debilitated me very often. So I started out with uh, I would say about a golf ball size lump under my right armpit. And that turned into most of my body in your typical areas being affected with HS. So under the breasts, the groin, the armpits, the buttocks, the thighs, the torso, my back, those different areas were affected, and it impacted everything in my life because it took over my experience. And that delay in diagnosis is, I would say, a contributor to that. If I would have gotten some type of intervention closer to when I developed it, would I have been as bad as I was? I'm not sure, but I think I would have liked to know, and had the chance to find out, which I didn't have that chance because by the time I did get diagnosed, my whole body was affected and I had stage three, early stage three, severe HS. And the treatment options were far and few in between. They were your typical thing, the antibiotics, the different hormonal therapies that are out there for HS. But when I finally got diagnosed, I got a chance to enter into clinical trials where lasers were introduced, and I was able to go on a different series of antibiotics, and other like washes and lotions and things of that nature. And I didn't really see too much of a change. But later on in my life, I did some things to help change my diet and my lifestyle, which I did see some changes in my HS. But of course, as we know, I didn't see it completely go away. So I had to get surgical intervention. I got CO2 laser, which really helped to transform my experience with HS. And then eventually I was able to get into remission. But, I definitely wish at the beginning of my journey I had way more support from my HCPs, because I think that would have made all the difference in my journey living with HS.
So, what do you wish physicians would know about HS? I mean, maybe even what do you wish they would have known, but even still now, what do you wish physicians knew about HS? And are you living with HS?
Yeah, I wish they would know that everyone experiences it differently. So w- sort of like what Dr. Daveluy was mentioning earlier, how it presents in skin of color is a lot different. And then also everyone's not dealing with aggressive stage HS, like stage 3 HS. So some have milder forms of HS, which means it might be confused with something else. And that means that patients are flying under the radar, and they could progressively get worse, or they may be misdiagnosed with something like HSV, 1 or 2, or something of that nature, or some other dermatological condition that is not hidradenitis suppurativa. And so I really wish that more physicians, more dermatologists, more healthcare professionals were well versed in how HS presents on various skin types, but just in general, because I think that that would help to close this misdiagnosis gap and this diagnosis gap, not only for people of color, but for the entire community.
Yeah. Can you talk to us a little bit about how stigma, pain, drainage, how do these things that are common in HS impact quality of life for patients?
Yeah, this is always hard to talk about because I have been impacted by the drainage, the pain, and the stigma of HS my entire life. It has completely debilitated me, not only physically, but mentally as well. I have had to deal with severe depression, anxiety, social anxiety, suicidal ideation, and all these different things because I felt like my body wasn't good enough. I saw it transform before my eyes, and there was nothing I could do about it. And psychologically, that messed with me. And I didn't really know how to articulate my experience, especially at a young age. Being 13 and watching your body literally deteriorate before your eyes, it's very difficult to really put into words how that impacted me. But I can definitely tell now, as an adult, I've had to do a lot of work, through therapy and other somatic practices in order to create a better relationship with my body after dealing with this condition, especially being in remission now. But physically, the pain was so debilitating that there were often times that I couldn't go to sleep because there was an abscess on my chest. And because I am a large chested woman, especially when I was a young child, the gravity would caused so much pain to the point where I wanted to rip my skin off because I was just like, maybe I can get some relief that way. I would have to sit up and sleep on the couch, or I would just only get like 2 or 3 hours of sleep, and I had a full day of school. So things like that. The itching, the itching is incredibly also debilitating because it interrupts sleep. I would have moments where itching would only happen at nighttime. So I was up, just scratching away, just itching away. Sometimes it would happen during the day, and, scratching, especially intimate parts as a young child or as an adult in general, in public can be embarrassing, and just
living with HS in areas like the armpits, like the groin, like the buttocks, like the thighs, limits you on the things that you can wear. And so a lot of the things that I love to do, like wearing tank tops or going swimming, were they felt like they were stripped from me because I didn't know what people would say. I didn't know if they were going to point, if they were going to laugh, if they were going to shame me. So there were a lot of different levels and barriers that I had to get through as a patient, the stigma, the pain, the drainage. It really impacted my entire journey because I would wake up with, my whole clothes drenched in pus and blood. And so all of those different factors really impacted the way that I showed up in life and just my journey in general with this condition.
Thank you for sharing that. I think, those are the things that we as physicians can't see. We can about them, assume them for the brief moments that we have our patients in our clinics, but really understanding how HS impacts patients, that those stories have to come from our patients. And those are the things that help us understand that what we clinically see does not give justice to how much, the condition is impacting patients. And so it also can impact how we decide to treat patients. So when we talk about developing treatment regimens, I do think considering quality of life is something that's very important. So not just what physicians are seeing in the clinic and grading as early stage, 1, 2, or 3, but having a better understanding of how is this condition impacting, this patient and their daily life. So I really appreciate you for sharing that. So, on that note, let's talk about treatment strategy. So, both of you feel free to chime in, but what are some advances in management that have been helpful or that you're excited about for now and the future?
There are so many things coming out. I always say there's never a good time to have HS, but this is the best time that there's ever been. We have now 3 FDA approved treatments in adalimumab, secukinumab, and bimekizumab, and so many studies are underway, which is so exciting because we need more options. It's a tricky one with HS. We're always talking to our patients so they understand there's not sort of a easy one size fits all, this is definitely going to work for you. It's much more, figuring things out and trialing different things to see what's going to work. But that's why getting more of these options out there. And plus, it's just exciting. I feel like a lot of patients are excited to see the research happening because finally people care about HS. Finally, pharmaceutical companies are investing in HS and spending the money to bring drugs to market and do this research. And then the other piece of it that I think is really exciting is now that there are more effective therapies, so many more dermatologists are saying like, okay, I'm going to take this on. I used to kind of throw my hands up and say, I don't know what else to do for my patients, but now these things are coming out. And so they're learning and we're teaching them things like combined therapies. Most patients need more than one treatment. You're not just going to put them on a biologic and you're done, like with psoriasis, where it's so easy now. Hopefully we get there one day. But you're going to combine things like Jasmine was saying. Maybe it's going to be a biologic and a hormonal therapy, maybe some courses of antibiotics, maybe some other things to kind of, and we're very lucky that most of our HS treatments can be safely combined. There's not a lot of things that interact with each other. So you can kind of pick from different aspects of, okay, I'm going to do something to fight the bacteria and something to regulate the immune system with a biologic and something to handle the hormonal aspect of it. So I think it's a really exciting time. And we're also seeing people doing more of the in-office procedures, which I always tell people, if you're just doing medications, you're going to hit a wall. There's going to be tunnels that don't respond. There's going to be a piece that needs a little surgery. So I say calm things down with medications first, and then look at what needs some surgery. So if they have that one tunnel that still is draining and giving them problems, or that one cyst abscess that just keeps coming and going, you say, all right, let's do some little mini procedures on there.
I think that's awesome. I think we do those things in our clinical practice with, we do biopsies all the time. If you can do a biopsy, you can do a deroofing, and it's just as simple as that. Um, Jasmine, are there things that I know you have mentioned that you're in remission, but you definitely mentioned CO2 laser and, other therapies. Are there things that you're excited about coming up, or things that from the perspective of advocacy that you're excited about coming up soon?
What I'm most excited about is, and speaking from experience, is all of these therapies, meaning that patients have options, or people living with HS have options, and that they're not having to move from a place of desperation. They're not having to make choices from a desperate place, because I've done surgery, you know what I mean, abruptly, without really thinking it through, really asking the right questions, and I'm still paying for it to this day. And that was because I was so desperate for relief. I was so desperate for some normalcy. And I really think that these options, whether they be biologics or antibiotics or hormonal therapy or something more on the natural spectrum, I think that this provides people living with HS with a smorgasbord of options to choose from, so they can feel empowered and they don't feel like they have to exist in a box. And they can really experiment, So it's like, if the biologic doesn't work, then this other thing can work. Or like Dr. Daveluy was saying, or before that, a combination of some things can help as well. Um, I'm really excited for the different methods of surgery and wide excision that patients have the options of using when the disease is more mitigated. I know that I'm an advocate for it, especially if there is a physician or a surgeon who knows what they're doing, and can do the wide excision correctly. I think it's transformative. I've experienced the transformation of having wide excision done properly. I've had it done for over a decade, and I haven't had any lesions or abscesses in those areas, and I thank God every single day for that. But those are things that I'm very excited for the community, because it just means that we are going to be more empowered and we have more hope, which everybody living with HS needs more hope.
Yes,
Mhm.
thank you. Again, definitely from the treatment standpoint, but also from the patient standpoint of knowing you have options. I think that is so, so important. So, what can clinicians do to improve patient trust, better educate patients for better shared decision making? Either or both of you.
Um, I would probably say, one of the things that I love is a physician or a healthcare professional that wants to like work with the patient. So really asking them, hey, what are your pain points? Like, what are you dealing with the most? Is it drainage? Is it itching? Is it pain? Is it a combination of all of these things? And then figuring out a treatment method that correlates with that, because I think that that allows the patient to be in the driver's seat and the physician to be sort of that co-captain and say, hey, I'm here to help you, and I'm here to really address the things that you need, so that you can live a better life. Because oftentimes, sometimes when we go into the office, doctors are like, it's about what I think you should be doing. And it's like, okay, well, I also want to have a say in this journey. And, based off of either culture, environment, some patients or people living with HS don't have the strength or the knowledge or the courage to speak up. And so when HCP reaches out and says, hey, this is just as much as your journey as it is mine. I'm here with you, and let me ask you questions. I think that not only heals their relationship with the healthcare system, but it creates a bond that I feel like the patient will never forget. Like, anytime I have a chance, I talked about Dr. Hamzavi because he changed my life. He was my dermatologist for 10 years. He's the reason why I'm sitting before you today. And I will tell it to anybody who will listen because he listened to me. He asked questions, and he, really advocated for me and asked me what I needed. And so that made all the difference. And I really wish for every physician as much as possible to do that with patients who are living with HS.
Thank you, Jasmine.
Yeah, and I'll echo that. I think that is so perfect. And I think with HS, it's really important because there's so many aspects where maybe one One patient feels like there's a connection with their diet and they want to explore that more, and you've got to be there for them and be ready. Maybe another patient either doesn't see any connection with diet or just is not in a place where they want to consider changing their diet right now. And so you don't want to, like Jasmine said, you don't want to be like, well, here's what you're gonna do. You're gonna change your diet. You got to meet people where they are and understand that it's a longitudinal relationship. You're on a journey together. So maybe you won't talk about diet today, but maybe down the road they'll say, hey, I've been paying attention, and maybe there are diet things I want to talk to you about now. Or maybe what are some natural options? What are some supplement options? So it's good to kind of not close doors. And if you don't know something, it's okay to tell the patient, like, I'm not real familiar with those, but I'll look them up. I'll learn some more and I'll come back to you and figure it out. And that means the world. Like, patients love that when you don't close a door for something they're really interested in. You allow that space to talk about it and consider it. And if you don't know the evidence, try to find the evidence, just like you would if someone came in and said, I heard there's a new medication for this, and you hadn't heard of it. You'd go look it up.
I think that is awesome. And I think that is what we hope to do as physicians, but sometimes we get a little off base assuming we know what's, best for our patients. So thank you both so much for sharing that. So we are starting to wrap up. So each of you, what is one last closing thought or comment you want to leave us with for today's episode?
Do you want to go first, Jasmine, or me?
And do you want to go? You can go ahead first.
Well, I hope I don't steal yours. And I honestly thought of this before your last comment, but mine is that it is so, so important to give HS patients hope. So all of my patients, I always say when they're new, I say, I'm so glad you found me. We're in this together. I'm not going to give up on you. I am going to keep at it until we get you under control. And that, especially to an HS patient who has heard the exact opposite from so many doctors who go, I don't know what else to do. Sorry, don't make another appointment. Find someone else. That just saying that you won't give up and you'll stick with it. I have some patients who, honestly, I am still struggling to get their disease under control, but they are so satisfied. And it's funny because usually I'm kind of there and providing emotional support for the patient, but sometimes they're like, Dr. Daveluy, it's okay. I can see that you're really stressed out, that we are trying so many things. I just appreciate that you're trying. And I'm like, thank you for comforting me. Your HS is really bringing us both down, and I appreciate you being there for me. But it's that connection we have where they know I'm not going to quit. I'm going to keep at it. I'm going to keep going. And maybe if HS isn't your thing as a dermatologist, make sure you have someone that you can refer your patients to who takes all your same insurances, who is an HS expert and can handle those head scratcher cases that you can't handle. So that way you're never leaving the patient high and dry. You're saying, like, all right, your disease may be more than I can handle, but I have someone I can send you to. But if not, be that person. Be the one who says, I won't give up. I'll keep learning and doing more.
That's awesome. All right, Jasmine, what do you have for us?
I just want to say that HS is not your fault. And I know that you're probably going to hear this from many different people, but I want to reiterate that it's not your fault. You didn't do anything to deserve to live with this experience. It just is the card that you were dealt. And I want to let you know, like Dr. Daveluy said in the beginning, it is a great time to have HS because there's so many options. And not only that, but there is a community that exists that is waiting to hold you and to care for you and to really be there to fill the gaps of what you're not able to get in your everyday life and experience. Because a lot of us don't have people in our lives who have HS, but that a community exists online for a reason. And groups like my nonprofit and other organizations out there, we have events where you can come and meet people in person and really get a chance to deepen your relationships in the community. So join a nonprofit, or attend an event, or reach out to an influencer or an advocate online and really build that bond with the community, because it will change your life. And you don't have to be an advocate in the ways that other people are, but find your lane and find your voice, because when I tell you it will change your life, I was a young girl who was recluse in her room, scared to speak and use her voice. And I am screaming from the mountaintop now that I have HS. I started a nonprofit now with HS. things can change for you, I promise, and they will get better. So that's what I want to leave with you.
Well, thank you. Thank you both so much. And thank you all for engaging in this insightful conversation. But that wraps up this episode of Skin of Color Savvy. Dr. Daveluy and Jasmine, thank you so much for your time. We hope that you found today's discussion informative and inspiring. If you're interested in learning more about the Skin of Color Society and its impactful work, I encourage you to visit skinofcolorsociety.org. Please don't forget to subscribe to HCP Live's newsletter and follow us on social media to stay up to date on the latest in dermatology and more. We'll be back soon with another episode, so be sure to subscribe to Skin of Color Savvy on your favorite podcast platform. Until next time, take care and thank you for listening.